You will remember that earlier this year, that's on the 30th of March, the COVID-19 Emergency Response Fund Board was appointed and they were commissioned on the 2nd of April. Now, to date, they have raised over 2.8 billion shillings. And so tonight, we'd like to speak to Jane Karuku, who's the chair of that fund. And she joins me live now for that conversation. So we will have her on your screens in just a moment. Jane, good evening. Thank you so much for making time for us tonight. I'd like to begin with how the 2.8 billion shillings is being spent. How much of it has been spent so far?
So, thank you, Yvonne, for having me. We've just started spending the money. So the first, if you remember, our priorities were two. One was to support the health issues associated with COVID-19. And the second one was to support the vulnerable communities in Kenya. So firstly, we spent about 237 million shillings to buy PPEs for the frontline workers. And we started dispatching that from last week. We've also ensured that we've bought all that PPE locally because we, as a board, are committed to buy Kenya, build Kenya principle. The other amount of money we spent, we are going to spend about 500 million shillings through M-Pesa to give to vulnerable communities in estates in Nairobi, in Ngara, Langata, Kwambio, Mukuru, Kibra, etc. And we are giving these people 1,000 shillings per week for the next 4 weeks. And then we've also spent another 95 million shillings to support psychosocial issues with the health workers. We know it is very tough for our health personnel. It's stressful, and we need to help them deal with the stress associated as they take care of us, all of us. We're also buying masks, cloth masks, for the vulnerable communities, about 1.3 million, which we are starting to distribute this week to Juakali workers, to Mamambogas around Nairobi and nearby towns.
I want to ask you this other question. You were commissioned on the 2nd of April. Of course, we saw the funds starting to come in. What were you doing in the interim period between the 2nd of April and just last week when you said that's when the disbursement of the funds and the spending began?
Yes, so we are 4 months old today. And when we were set up, we embarked on setting up systems, A, to fundraise, and B, to make sure that we are going to utilize every shilling properly. So we set ourselves as a company limited by guarantee because we wanted to be able to transact. The second thing we did is to organize ourselves around board committees. Remember, we are mostly corporate, and that's what we know best. So we have committees led by board members, and I want to thank all of them. The first one's with your boss, Wachira Waruru, who heads our communications pillar. Then we have a fundraising led by Jeremy Awori, the CEO of ABSA Kenya. The other one we have is Phyllis Wakiaga leads our procurement and logistics committee. We then have Joshua Oigara leading our welfare and livelihoods committee. We have Michael Joseph leading the technology platform or the technology committee, as we believe the way to give people money is through M-Pesa or e-wallets so they can grow their local ecosystems. And then we have the last one, which is led by James Mwangi, which is health committee.
Yeah, so you've been, putting yourself...
So that's what we've been trying to do.
Uh-huh.
Yeah.
No, carry on.
And then we opened a bank account with ABSA Kenya and an M-Pesa number, which I'll share later so that Kenyans can give us more money. So basically the last few months, which is 4 months, we've been trying to get ourselves organized, grow local industry. So for example, all that we are giving people in terms of PPEs, we are buying locally. We've worked with local manufacturers to build their capacity. We've been lucky to be supported by institutions like IFC, DFID, McKinsey to train our industry so they can bring up their quality to be acceptable and safe for our doctors. The other thing we did is as a board, we decided to co-opt professionals. So if I just talk of the livelihoods one, we have people you might know, Kennedy Odede of Shofco. We have Mr. Dalberg, CEO International. And then we have, for the health one, we have Professor Masharia leading a group of very dedicated young doctors from KPMDU, from Nurses Association of Kenya, to try and get us to that next level of quality. And in fact, not only have we bought for Kenya, I think last week we got an order from one of the factories we've been working with to export to DRC a value of 100 million shillings. So we've been busy, although maybe Yvonne may not have been visible to the public.
Yeah, and you took the next question I was going to ask, which is the sort of outside support and expert advice that you're receiving that I suppose would guide your decision making as to the priority areas. So there's people who are looking at the fund, they're saying there's 2.8 billion. By the calculations that you sent in, you spent maybe about 800 to 900 million so far. Can groups, organizations, community groups that are coming together, can they come to the board and make an application and say, this is what we're doing in our community and we need this sort of support? Or, hey, we're over here. You may not have considered us, but we need this type of support. Is that possible with the fund?
Yes, a lot of requests.
We do get a lot of requests already. Remember, we have two pillars, like I said, livelihoods, which means mostly food. So we coordinate donated foods or organizations who want to donate food. And between what we've received and what we've coordinated is another 800 million. So that is ongoing, and we get requests from villages, from church communities, etc., etc. So, but remember, unless on the medical part, it is about livelihoods and protecting our frontline workers. Right now, that's what we want to concentrate on. And we've committed as a board that the money we have for that particular pillar, which is about 1.1 billion, we will spend on PPEs for the health professionals for the next 18 months. We'll make sure that all 54 COVID-designated hospitals have adequate supply of PPE because we need to protect that group of people.
In the beginning, we saw quite a bit of, there was lots of enthusiasm from corporates and even a few individuals that we saw giving in money. It was hundreds of millions. And it got to, you raised $1 billion pretty fast. You got to your first $1 billion pretty quickly. It's been well over 100 days now of COVID-19 in the country. Are you seeing some sort of slowdown, in terms of getting funds, getting donations?
Yes, Yvonne. Every Kenyan is very stressed, whether it's a corporate or individuals. I think when COVID came, we all thought it was going to be a 1 week, 2 week affair. Now, as we listen to the CS of health, we get worried. He talks about peaks in coming months. So I think everybody's stressed. Businesses are not doing well. Human beings are stressed in Kenya from a financial perspective. So we are seeing a slowdown. But having said that, I think we still get every Saturday, I think we are receiving money and not in the billions like we would like. And therefore, I'm appealing to Kenyans to still come because the needs are so huge. And we all need to come together. Not even government, not big institutions can deal with this. I think we all need to come together in the Kenyan spirit of Harambee and support each other to get through this.
All right. Like you said, we're in it for the long haul. All indicators point to us living with COVID for the long term. And of course, this was to cushion us, during this period of decreased economic activity. My last question to you is two-pronged. One, what's the end game? When do you see this coming to a close? And then also, what specific measures have you put in place to ensure transparency and accountability of the funds that you have been receiving to the members of the public?
So when we were setting ourselves up, and remember everybody's giving their time for free to this fund, we are working with PwC. PwC is our bookkeeper. So they see every inflow, every outflow. So they are managing that, all for free. We have Deloitte who've also volunteered to assure our processes, especially after we transact. Then we have Ernst & Young, who've really helped us develop the procurement processes to make sure that it is transparent and it's beyond reproach. And then we have KPMG, who are coming on board also to help us with M&Ing in terms of the activities that we undertake. So we are fully transparent. We also have a website where all transactions are visible. And I think to your last question, how long we are going to be or what's the end game? The answer is, to be honest, we do not know. We were hoping it's a 3-month affair and we get disbanded, but I don't know. I really don't know. So I'm appealing to Kenyans. I think the more we behave, protect ourselves, follow the guidelines, the rules and regulations we are receiving from the government and other people, then we can stop the spread. Then maybe our term can come to an end quickly.
Indeed. Thank you very much for speaking to us here. And I know at the beginning you said you would make everything public, and so we invite you to, come again and again and share what you are doing on a periodic basis. Thank you very much, Jane Karuku, who is the chair of the COVID-19 Emergency Response Fund, telling us about how the 2.8 billion shillings raised so far from corporates and various individuals in the country has been spent so far. Jane, thank you for that.